So let's take you now to this. South Africa's health sector has transformed in the last 30 years, but it still faces significant challenges in accessing fundamental healthcare. The healthcare sector is struggling with a shortage of human capital, outdated infrastructure, and insufficient funding. The National Health Insurance, or the NHI, is seen as a potential solution to many of the obstacles that patients are currently facing and addresses the inequality within the sector. 3 decades later, how is South Africa's healthcare system coping? Well, to help us unpack this, we're now joined by Professor Benjamin Smart. He's the director of the Center for Philosophy and Epidemiology, Medicine and Public Health at the University of Johannesburg, Mr. Russell Rensburg, Director, Rural Health Advocacy Project, and Mr. Anele Yawa, the General Secretary of the Treatment Action Campaign. Gentlemen, thank you so much for your time. So before structural and systemic issues, let's look at the gains and the advancements in the health fraternity in the country, at least over the past 30 years. Professor Smart, maybe let me start with you. I mean, what for you stands out as notable advancements, especially when you compare the country with other similar markets in the medicine and public health?
Right. Well, if we're going to go right back to the dawn of democracy, I think some really good strides have been made. So pre-1994, the health sector was run by 400 local authorities, and that led to serious coordination problems, even more health disparities than we see today. That model was very problematic. So Nelson Mandela's government consolidated that. We now have 9 provincial regions, and that's led to more coordination. The government built, lots of clinics, improving access to particularly the poor and rural communities. I mean, obviously things aren't as good as they should be, but they're certainly better than they were pre-1994. And probably the biggest strides I see, one of our panelists here has HIV posters all over his wall. One of the greatest strides we made was the sort of post initial Mbeki disaster, moving into the ARV program. And we now have the largest antiretroviral program in the world, servicing nearly 6 million people. And that saved countless lives. So yes, there are serious problems in the healthcare sector, but it's not all a tale of disaster. Some progress has been made in 30 years.
And I hear you, but seemingly it would seem that just some of the good work is being overshadowed by what we're currently seeing. Mr. Rensburg, when we look at how highly unequal our society and especially our healthcare system is, I mean, is it overshadowing the gains? Just give us your thoughts then on how government is trying to balance, as it were, the scales with, for one, the NHI, and how that bill is now awaiting the president's signature. Just given that the public sector is so underfunded, is this the solution?
There's no straight line solutions to anything. Health is a very complicated issue. And I think we start with the notion that healthcare needs are unlimited, but the ability to respond to them requires money and resources, right? So a country like ours, like Professor Smart so correctly pointed out, with our long history of inequality, over 300 years of racial suppression, a lot of the healthcare needs of the broader populations were not, despite the 400 authorities that was overlooking it, weren't fully addressed. Then we moved into democracy with the same health system that was quite advanced, even up to quaternary care. And we confronted one of the world's largest pandemics, which is the pandemic of HIV and AIDS, which reluctantly we didn't respond to quickly enough, but we are now in a better place. But it's changed the shape of our health system. But health is also not constant. People's disease profiles change. We may have close to 6 million people on treatment for HIV now, but we have almost no cover for people living with diabetes, many of them living with HIV. We have one of the world's oldest diseases as the leading cause of death in South Africa, with tuberculosis, and that's close to 50,000 people dying every year from a treatable and preventable disease. But I think the question that the NHI poses to us is really, are we organizing our health assets in the correct way? Do we place enough of an emphasis on district health services, where 80% of the population live? Do we really think about the determinants of health, which are the broader social determinants, including things like income, access to education, social assistance to those who need it. And I think where we are right now, despite the major successes in population health, we have increased survival rates for children under 5. We have decreases in maternal mortality. We have fantastic coverage on, but not great coverage, but great coverage on infectious diseases. But, are we really keeping abreast with the health of the population? And I think restructuring, which is proposed by the NHI, is probably the next step for the 7th administration, is to bring health closer to the people and also to give us an attempt to better understand how we maintain our higher levels of care, which are currently being overrun, partly because they're also delivering primary healthcare services. So I think we have all the pieces and all the ingredients to bake a really good cake. But what we need is good political leadership, some prioritization, particularly from government, because health for all is a political choice, but we need to do more for the 80% of the population. And these are not just pregnant mothers. I think the last statistic I want to leave with you, 75% of working South Africans earn less than 6,000 Rand a month. Right? They can't afford to access primary healthcare at our clinics because it requires a day out of work. They can't afford medical insurance, right? Because then they would have no money left after transport and other costs. And I think if we're going to celebrate and realize the right to health, we need a healthcare system that's responsive to the needs of the broader population. And that will require any incoming government or prospective government to start reflecting on prioritization and making sure that the 80% can access quality healthcare services. But yes, we've made significant progress over the last 30 years, but unfortunately it was fragmented. And by and large, rural districts are still fairly worse off than their urban counterparts. Thank you.
And I will come back, to the leadership and prioritization a little bit later on. But let's talk now about, just demand versus what we actually can, the capacity that is there. Anele, Mr. Yawa, I want to bring you in there now. The country's healthcare system, was already frail before COVID-19, and it further, I think, crippled the healthcare system, especially, in provinces like the Eastern Cape, Free State, KwaZulu-Natal. We also saw, of course, the burden of COVID-19 to people suffering from and living with other conditions, including HIV/AIDS. What has, for you, the pandemic exposed about South Africa's healthcare system, and how do we capacitate the system to meet the health needs that currently exceed that capacity, do you think?
Thank you for having us. And I want to agree with my two comrades, Comrade Benjamin and Comrade Russell, to say a lot has been done in our country, but a lot also needs to be done, because one will remember when we fought for the freedom, we never said we want freedom in the future. We said we want freedom now, freedom in our
lifetime.
Comrade Russell is talking about a lack of political commitment and a political will. We have MECs and other officials who keeps on going to people, make promises, and when they are held accountable, they are unable to deliver on that. Two, we have new challenges as the country, where you have a shortage of human resource for health, and as the result of the shortage of nurses, the ones that we have in the system now are overburdened, and as the result of that, they are unable to deliver on the demand. We often see healthcare workers' unions embarking on industrial strike, which contributes in disruptions of healthcare services for the needy and the majority of our people. How do we address that? We also see currently that issues of the patient and the nurse safety is of paramount. We see a lot of nurses, we see a lot of clinics being closed because of criminals come and rob nurses. How do we make sure that we beef up security in our clinics so that our health establishments are not broken into? We also see in a number of areas where some of the healthcare workers are stealing medicines which are meant for the people and steal these medicines to sell them in our communities, whilst they are depriving the majority of the people. Where is the commitment? We have seen during the time of COVID, where those who are in close proximity with the politicians stealing money of the PPEs. How do we curb corruption within the healthcare system so that each and every cent that our government allocates for health goes to purchase healthcare services instead of it being stolen by those who are corrupt? And how do we make sure that people like Brian Hlongwa, when he was the MEC of Health in Gauteng, the SIU report, which was commissioned by the President Ramaphosa, came out clear that his hands were found on the cookie jar. When are we seeing people like Brian Hlongwa going to courts of laws and being prosecuted? We have seen how people like Dani Mahlangu in Gauteng massacred mental health care patients at Epidemiology. When are we going to see those people who are in close proximity with politicians being held accountable? But amongst them all, our clinics are very small and the infrastructure is falling apart. We want to see our government taking, as Comrade Russell has said, he spoke about priorities. We cannot continue to see our people waiting in long queues in all conditions of weather outside there without any shelter.
Mr.
These
Yawa,
are the things which we think.
Mr. Yawa, thank you so much for that. I want to touch on that prioritization before you continue. And perhaps, let's delve in. I mean, I've heard accountability. I've heard a lack of will, political will in terms of a lack of leadership, I would imagine. Let's then talk about how do we then capacitate the system, to meet the health needs that currently exceed capacity. I mean, what kind of reform is then needed? Perhaps, Prof, let's start with you, Professor Smart.
Smart.
I think there's a serious problem in funding. I mean, the South African health budget is just over 60 billion rand. And when you compare that to the NHS, which would be the sort of equivalent of the NHI and its services, a similar sized population, the budget of the NHS in the UK is 4,000 billion rand. That compares to 60 billion rand. And even if you throw in all the medical aid money, suppose NHI effectively sends the medical aid money to government to spend on healthcare for all. I mean, that only gives us 125 billion, which sounds like a lot of money, but it's not a lot of money compared to 4,000 billion. And then when you add in the point that Mr. Yawa just brought up, which is that an awful lot of that money is lost to irregular expenditure. The real issue, I think, is funding. And of course, we want excellent healthcare for all South Africans. Everybody wants that. But there's a matter of implementation. So I have my problems with NHI aren't so much in principle. It's more about in practice. What about our current government would lead us to think that the NHI would be implemented properly? 500 million rand was spent on skinny jeans at Tembisa Hospital. The former Minister of Health was, or at least their family was implicated in digital Vide scandal, hundreds of millions there too. There's just no real reason for anyone to be confident that government is going to run NHI appropriately. And I think that's a serious issue. And also there's a further problem that it seems to me that this is just going to go straight to the Constitutional Court. I mean, the way the NHI bill is framed at the moment, it seems like it just takes away the option for people to pay for their own medical care, right? To use medical aid schemes to guarantee access to good quality healthcare. Now, it might well seem fairer for it to be more of a lottery, whether you're rich or poor, you've got an equal chance of getting access to the private hospital, and that might be right, that might be fairer. But there's a certain reality of a real risk of an erosion of the tax base. If people just cannot guarantee their families good quality healthcare, then the tax base will erode and there will be no money to pay for NHI. There will be no money to pay for SASSA grants or for roads or for hospitals or for education. So whilst, in principle, I think something like the NHI is not such a terrible idea. It's all about implementation. It's all about cutting costs to ensure that procurement processes are followed properly and we're not paying double the price for a bandage than we can spend by going into clicks.
Yeah.
And there's so many places where money can be saved. And I think really we should be starting there. Really what should happen is government hospitals should be working on sorting out their finances, ensuring that all this irregular expenditure is wiped out, and that we're spending the right amount of money on procuring goods and services.
Mr. Rensburg, I want to bring you back on the topic that you mentioned earlier, 75%, of working South Africans earning less than 6,000 rands. And we haven't even touched on the rural communities who, make up over 40% or so of the population. I mean, they also face, tremendous difficulties and challenges. When we then start talking about prioritization, what are we saying here in as far as rural communities are also concerned?
Look, firstly, I think we need to get some definitional clarity around what are the things that we need to address immediately, right? So, personally, South Africa signs up to the SDGs, which is the Sustainable Development Goals.
Yeah.
SDG 3 speaks to universal health coverage, and underneath that, it lays out 4 broad health conditions. So the first of those are maternal and child health, which incorporates sexual and reproductive health. The second component is infectious diseases, which is HIV and TB and pandemics like COVID. And the third component is non-communicable diseases. And they've basically put us all on track to make sure that those with the least access get the service coverage. So in some ways, the reforms are not about universal health care, but universal health coverage, beginning with essential health services. So that's the first thing. So that's the path that we need to be on. Currently, we're only about 60% of the way, and we have 5 years left to get there. Right, so when we look at the NHI, it's not 60 billion, we have 260 billion rand when you consolidate healthcare expenditure at the province, which is where healthcare services are delivered. Right, the 60 billion, 85% of that also gets transferred to provinces. So I think we need to make sure that the funding issue is something that we need to zone in and understand better. And I think the view that we've taken is to really progressively realize the right to health as envisioned in our constitution. We can't sort of have this process where we're all starting the race at the same time, but some people are starting the race at 50 meters and then winning the race. We have to ensure health access at the lowest level, closest to where the people are. And that's where the prioritization is. Let the data lead us. Right? The governance and the political choice is about making those hard decisions. Right? So how do we look at and I think not giving hospitals their own budgets is a problem, right? If they don't have their own budgets, then they can't be accountable for those budgets, and we can't be accountable for the services that they deliver. But I think at the very least, the main priority that we need now is to strengthen district health services. And we need to organize them in such a manner that they're responsive to the needs of the communities that they serve, rather than just one unstandardized package, which is outside of the National Health Act. One of the things that the Health Act asks is for uniformity. But in this country, depending on where you live or who you're born to, the package of services is different. And we're not going to get people into better health if we don't start somewhere to say our first priority is to expand service coverage and essential health services. We must make sure that when it comes to maternal and child health, that mothers don't sit 14 hours in a chair waiting to find a bed. Right? We must ensure that people living with TB are able to access treatment where they are, wherever they are.
Yeah.
We must make sure that people that are living with HIV are retained in care. And I think it's really just about organizing our assets in such a manner and our funding so we prioritize where we can make the biggest population health impact. And for us, including in rural, is at the district level. The current system doesn't allow that. Every province runs their health system like it's a country. There's no prioritization. And even in the most recent 2024 budget, we saw some provinces cutting frontline services, district health services, clinics, district hospitals by as much as 18%. Yeah. Right? So you're cutting into the bone already. So there's no prioritization.
Mr.
So
Rensburg,
for me, the final point is, if we want to...
Mr. Rensburg, no, I think we heard you. We're just fast running out of time. And I want to add just, I want to give Mr. Yawa the final opportunity to speak here. Mr. Yawa, I think we covered a lot in terms of the gaps and where priorities should lie. One of the things that we haven't touched on, and I think Mr. van Rensburg mentioned it in his last point, is the frontline workers, the healthcare practitioners. We've seen over the past couple of weeks how we talk about shortages in terms of doctors in this country, but we see how some doctors are being treated as well as nurses. In the main, what should government do in as far as prioritizing those very doctors that went through their systems in terms of practice but are sitting without a job as we speak?
Yeah, in order for our government to be able to address the issue of the human resource for health, one, we need more resources for health so that we can be able to hire more healthcare workers and make sure that their living conditions are well taken of. Two, if our government is able to bail out ESCOM, SAA, and all what have you, the time has come for our government to bail out the public health care of our country. How? We've got a lot of money in this country. Our government is subsidizing the private healthcare system through the government employees medical scheme. Our politicians also are not using the public healthcare system, including those who are working in the public healthcare system. They are not using the public healthcare system. How do we take that money and redirect it and invest it within our public healthcare system so that we can have more resources? I so wish one day to sit next to the state president, to the MEC, as well as other politicians, all of us accessing the public healthcare system. It cannot be true that we will have policymakers who sit in parliament, those who work in the public healthcare system, yet when they are sick and dying and their families, they go to the private healthcare. We want to see MPs, we want to see the DGs and the nurses accessing the same healthcare system which the vast majority of our people are accessing. We cannot be talking about freedom in the future. We want freedom in our lifetime. The same freedom these doctors and nurses, these parliamentarians are enjoying in the private healthcare sector, we want to enjoy it within the public. They must stop using the private. They must stop investing in private and put more resources in the public so that we can be able to improve the quality of services. Lastly, we need to curb the corruption within the public healthcare system. We need to fight cadreship deployment within the public healthcare system so that all those who are employed by our government in the public are competent people who will be able to deliver on the mandate of the people.